The field of head and neck cancer is changing dramatically. It's no longer a field where we see patients who have smoked for 30, 40 years coming in with throat cancer. It is non-smokers now, it's young patients now. The epidemiology of the cancer is changing a lot.
So Hoag's head and neck cancer program is composed of multiple physicians from different multi-specialties. We have incredible physicians, radiation oncology, medical oncology, and head and neck surgeons. But also we are supported by the Cancer Center by having a speech-language pathologist in the clinic, our registered dietitians who have specialized training in oncology, a head and neck cancer nurse navigator, and incredible staff that is well-versed in the care of patients undergoing this really difficult treatment.
A nurse navigator is critical in terms of patient management. Oftentimes, patients are lost when they are diagnosed with cancer, especially head and neck cancer. There's so many moving parts to their therapy. They need to see surgeons, medical oncologists, radiation oncologists. They need their nutrition managed in a very specific way. Many of our patients need gastrostomy tubes placed in order to manage their side effects. And to coordinate all of this, to get all that support into their care is challenging. Not only for us involved in healthcare, but you can imagine as a patient just diagnosed with something like this, it's a challenge. And the nurse navigator really helps them coordinate all of the proper services that are needed for their care.
I love the opportunity to have contact with patients from that initial diagnosis to really help support them during that initial coordination of care. It might be helping them to get an appointment a little sooner than if they had just called. It might be meeting them one-on-one, providing them with some education, and just meeting the whole family and finding out what that individual's needs are. Not just this is cancer treatment, but what are their needs and how can we at Hoag best support them?
One of the things that makes our Hoag Head and Neck Cancer program so unique is we have a multidisciplinary tumor board. It's a very unusual collection of physicians and support staff that come together several times per month to specifically focus on the planning and treatment options for a patient. And to find that in a community hospital-based setting is very unique. It's something that we've been doing for the last 2 or 3 years. We find that our outcomes are improving. Our patient care is significantly improved, and our patient satisfaction is significantly improved. Quality of life is a major consideration in the overall treatment planning for a patient, and it is a discussion that's very relevant at our tumor boards. And our goal is for the patient to be cured, but for the patient to also have a quality of life that for them is worth living. And that's not a decision that we necessarily make for the patient, it's a decision that we make in conjunction with what the patient's desires are. So it's a very important portion of the discussion process for these head and neck cancer patients.